Perfect. Thank you. It's lovely to be part of this exciting symposium this morning, and I have really enjoyed the last presentation. It gave me so much food for thought. So what I'm going to be talking about is climate change. The World Health Organization has described climate change as the greatest threat to public health in the 21st century. Climate change is an upstream determinant of health. It's also a socially and politically modifiable determinant of health, and one we have to focus on. Next slide, please. Our planet is in trouble, but we don't need more debate, procrastination, denial, or political handballing. The science is clear. Our world is warming. It's due to human activity. The warming is having a severe impact on human health, but we can do something about it. And as nurses, it's time that we stepped up and took responsibility to address the climate crisis. We need nurses in all the nooks and crannies of healthcare, in research, education, advocacy, and practice, to lead both in climate change mitigation and adaptation. Next slide, please. I'm sure some of the slides I'm showing you now they come from the media and you'll be very familiar with them. This one, heatwave claims over 1,000 lives as temperatures hit 51 degrees in Mecca. 2023 temperatures were the highest on record across the world. The thing to remember is that the people most affected by heat waves are the most vulnerable: older people, children and babies, pregnant women, outdoor workers, people with mental health conditions such as schizophrenia, people with cardiovascular and endocrine diseases, people who are homeless, who have insecure housing or poor quality housing, or don't have air conditioning or can't afford air conditioning. These are the people most vulnerable to heat waves. Next slide, please. You may have seen the media speaking about severe floods that are ravaging East Africa. In some ways, we're almost becoming immune to the extreme weather events being brought about by climate change. What we need to keep in mind is that low resource countries who produce the least global emissions are the ones most impacted by the high emissions of countries like Australia and other high resource countries. And it's the low resource countries that had limited infrastructure and ability to be resilient to these extreme weather events. Thanks, Nat. In Canada, record wildfires have spread to urban areas and led to internal displacement of thousands and thousands of people. And currently, there's still 230 fires burning across Canada. And thanks to fossil fuel-induced climate change, the wildfire season in Canada, North America, Australia, and other countries are becoming hotter, longer, and more unpredictable. The burning of these vast tracts of forest are polluting the atmosphere, not just in Canada, but thousands and thousands of kilometres away. And the emissions will have tripled Canada's emissions this year. Next slide, please. There are also severe droughts in many countries, and millions face hunger and water shortages as extreme droughts sweep through southern Africa. And in fact, 24 million people in southern Africa are facing hunger, malnutrition, and starvation due to the droughts and this is creating an unimaginable humanitarian crisis. In high resource countries, we can afford to buy food, even when the cost of food is exorbitant. But in low resource countries, droughts and floods make the purchasing of food almost impossible and lead to severe malnutrition and starvation. Next slide, please. The disease burden of air pollution on children continues to rise in Bangladesh and other related countries. A UNICEF report has identified alarming trends in air quality in Bangladesh, India, and across South Africa. And in 2023, in Bangladesh alone, there were over 235,000 deaths in Bangladesh, with 700 of these being related to being children under 5 years old, who were especially vulnerable, with health effects including prem births, low birth weight, asthma, and lung disease. The life expectancy for people living in Bangladesh, India, and some other countries in Southeast Asia has been reduced by seven years because of air pollution. And across the world, it is anticipated that all of our life expectancies will be reduced by at least 3 years because of air pollution and other forms of pollution, such as plastic pollution. Next slide, please. Deforestation also has devastating consequences, including social conflict, extinction of plants and animals, and climate change. Logging, mining, and farming in tropical forests displaces Indigenous communities, and left without land or other resources, native cultures often disintegrate. Deforestation leads to biodiversity loss, and vector-borne diseases proliferate. Climate change and habitats expand the range of disease-carrying insects, increasing the prevalence of malaria and Lyme disease. And ecosystem disruption affects food security and increases the risk of zoonotic diseases carried by bats and rats, for example. 50% of chemotherapy agents, statins, and antibiotics come from fungi and bacteria. And when we have deforestation and biodiversity loss, what we are actually doing is reducing our ability to create future medications that we're going to need. Next slide, please. Rising sea levels damage food sources and ancestral burial sites in the Torres Strait Islands. And the Torres Strait Islanders are among hundreds of millions of people across the world who are at risk of being displaced by rising sea levels caused by climate change. Next slide, please. Now, we often think that climate change is disproportionately affecting low resource countries, and it certainly is. But there are also low resource people living in high resource countries. So I'm going to tell you the story now about two families from Australia. On the left, we have the Murphy family. Charles, a GP, a general practitioner, Alicia, a high school teacher, and their children, Elizabeth and Finley. The Murphy family live in a new brick home. It has double glazing, it's well insulated, and it's powered by solar electricity, and they have ducted air conditioning. Both Charlie and Alicia drive electric vehicles. Charlie has a history of hypertension, but he's on antihypertensive medications, and he maintains a healthy lifestyle through his home gym and swimming laps at the local pool. Alicia considers herself to be an environmentalist, and she coordinates the local community garden. Elizabeth is in year 10 at an Anglican girls' high school. Like her mum, she's passionate about the environment, so much so that she's experiencing climate anxiety, but she's able to see a psychologist at least once a month. Finley has mild asthma. It's well controlled, he's able to play soccer, and he sees his doctor regularly. He has a good asthma management plan, and he takes reliever medications. Now, on the right, we have the Ellis family. They live less than 500 metres from the Murphy family. The Ellis family includes Jill and Damien and their children, Abby and Luke. Until recently, the family lived on their own 4,500 hectare cattle property. Despite droughts and floods over the years, they managed to stay financially afloat and were healthy and happy. Until 6 months ago, severe storms and heavy rains hit, resulting in unprecedented flooding of their property. The previous floods had never reached as high as the equipment sheds or the stables or their home. But on this occasion, the river rode with such intensity, and within 24 hours, it was at a level they had never seen before. The family lost more than 3,000 cattle, most of which died in the paddock or were washed away. This cattle were the result of a breeding program established by Damien's great-grandfather nearly 100 years ago. The insurance company continues to dispute their claim, saying they weren't covered for storm surges. Their house can't be lived in, and they don't have the money to renovate. So the family has moved into town so that they can work and try to pay off all their debts, farm debts. A family friend offered them a home to rent at a good price, but warned it's pretty run down. He doesn't intend to invest any money into maintenance, as he plans to knock it down and rebuild soon. There is no insulation, it has rising damp, and the air conditioner does not work. Matthew is now working as a labourer and a delivery driver after hours because they still have a big loan on their farm. He gets worried, though, about how long his car will last. It's a 1998 Land Cruiser. It's done a lot of kilometres. The air conditioner has not worked for years. Matthew also has a history of hypertension, but he hasn't had time to have a checkup. His prescriptions have lapsed and he's not taking antihypertensive medications at the moment. Jill works as a teacher's aide. She also does some casual cleaning jobs. On weekends, she works in a coffee shop. She misses the large vegetable garden she had on her farm, and she thinks the fruit and vegetables at the local supermarket are exorbitantly priced and of poor quality. Abby desperately misses her friends and schools. She can no longer compete in equestrian events as her horse was killed in the floods. She's struggling with anxiety and depression. She's on the wait list to see a psychologist at the public hospital, but she's been told that it could take 9 to 12 months to get an appointment. She does see her counsellor, school counsellor, occasionally.
Apologies, Tracy. I'm sorry. Apologies, Professor Tracy. Time.
Yeah. Oh, sorry, Priya. I didn't see the colour come up. All right, so I'm just going to go on to our next slide. Our call to action. A reminder that healthcare produces 5% of the world's carbon emissions, and nurses form the largest group of healthcare professionals, nearly 30 million. And we are trusted, given the expected increase in climate change impacts on human health. Current and future nurses must be able to respond effectively. Next slide, please, Nat. Last slide. So we must keep learning as much as we can about climate change and planetary health. We must speak up. We must embrace our political power and vote responsibly. We must practice and live sustainably in our work and in our home lives. And we must collaborate with others, other nurses, other healthcare professionals, and people outside of nursing and outside of healthcare to address this huge issue. Oh, sorry, last slide. We have to consider the legacy we're passing down to future generations, and together we can create a healthier planet. And really, the health of humanity depends on the health of our planet. As guardians of health, it's our duty to lead the way in this crucial fight. Thank you.